This epidemic started behind a pharmacy wall. It happened in a doctor's office.
So when Governor Ducey launched his campaign against opioid addiction, he started at the pharmacy window.
So we've had a reduction of 20% in terms of prescriptions filled.
Now, 2 years after the governor limited access to over-the-counter opioids, some are questioning his policies and whether or not they're working.
So we're cutting down on how many prescriptions we can write, and the overdose rate keeps going up. It's having the exact opposite of its intended effect.
Dr. Jeffrey Singer is a surgeon who works for the Goldwater Institute. Limiting prescriptions, he says, drives users to the streets.
This sounds bad, but it was actually better when they were using pharmaceutical prescription-grade opioids. Now we're taking away from them, they're using heroin and fentanyl. We should stop calling it an opioid crisis.
In terms of overdoses and deaths, state numbers show little has changed since the governor declared the opioid epidemic in June of 2017. 790 people died from opioids in 2016. In 2018, the first full year after the governor limited prescription fills, 774 people died. The number of non-fatal overdoses increased slightly in 2018 on a month-by-month basis. What has changed? Fentanyl, now the #1 cause of death, surpassing heroin and prescription opioid fatalities.
I'm not trying to trade one dangerous addiction for another dangerous addiction. We're trying to bring treatment and solutions and preventions across the board. So when you talk about opioids or fentanyl or heroin or methamphetamine, I'm not going to have a discussion with you about what's the preferable drug to be addicted to.
The governor says the crisis will not be solved overnight and admits to unintended consequences.
So there's more to do here. There's also been some resulting unintended consequences, what we're seeing with heroin and fentanyl and other drugs and addiction. But we're off to a good start with more to do to help people around the opioid epidemic.